this module, we're going to talk about decreasing the risk for brain aging, Alzheimer's disease, and other forms of dementia. So 11,000 people turn 60 every day now. The baby boomers are the largest sort of segment of the population, and they're in trouble. It's estimated that Alzheimer's disease is going to triple in the next 25 years. We have no cure for it on the horizon. Age-related memory problems escalate after the age of 45. Actually, with the obesity epidemic, the health problems in our country, it's actually lower than that. The working population is clearly aging. Alzheimer's is expected to triple in the next 25 years, but there is no cure. But there are very smart strategies to decrease your risk. You can start today. So I had a very interesting interaction with Todd, who's the Chief People Officer at Franklin Covey. He interviewed me for a series I did with them. He's 53. He's a very bad memory. He thinks it's normal. And I'm like, well, do you exercise? Yes, he's a marathoner. And I said, well, what do you have for breakfast every day? He said, Pop-Tarts and a Diet Coke. He's an executive at this huge company, and I'm looking at him like, seriously? And after our interview, he says, I now haunt him at every meal. It's just sort of my goal. I want to be that little voice in your head that reminds you to do the right thing. So, who wants to live to 85 or beyond? Rest of you suicidal? You may be at risk for Alzheimer's disease if you have a family member with it. If you have a personal history of a head injury, heart disease, strokes, diabetes, cancer, ADD, or depression. If you exercise less than twice a week. If you do not engage in regular lifelong learning. Now, there are many roads to dementia. Alzheimer's disease, one of the most common. Frontal temporal lobe dementia, where the front part of your brain deteriorates. That's the kind we saw in our football players. Out of our 150 players, not one of them was headed for Alzheimer's. It was all frontal temporal lobe dementia. Vascular dementia. Lewy body dementia, which is the dementia associated with Parkinson's disease. Alcohol-related dementia, which is very common. Chronic fatigue syndrome can give you dementia-like symptoms, brain trauma, and mild cognitive impairment is the term. It's sort of like you're on your way. Think of it as many senior moments. Dementia is defined as damage to nerve cells that results in a progressive difficulty with remembering, thinking, or doing your usual activities. And the important term here is it's progressive. What we found in the NFL players is there's this newly defined condition called CTE, or chronic traumatic encephalopathy. Many of them had their concussions, their multiple concussions, 10, 15, 20 years before they developed dementia, but it was a decade or 2 or 3 later where the problems accelerated. Alzheimer's disease, again, bilateral parietal temporal lobe hypoperfusion. First seen hypoperfusion in the posterior cingulate gyrus. There's, when you look under the microscope, there are beta amyloid plaques and neurofibrillary tangles. So it's like nerve cells get twisted on themselves. I want you to think of the brain as this incredibly sophisticated electrical field. So think of it as like an electrical grid. And the beta amyloid plaques, think of it gummy, gooey substance that gets dropped in nerve cell fields, causing multiple short circuits. In addition, there's tau protein abnormalities. It's actually funny when you go to an Alzheimer's meeting, they fight with each other. The scientists fight with each other. So there are Baptists that believe it's beta amyloid plaque deposition that causes Alzheimer's disease. And then there are Taoists who believe, no, it's not beta amyloid, it's tau protein. In chronic traumatic encephalopathy, the football dementia, it's probably tau. So tau proteins form the skeleton or the building block for neurons. And if you just imagine being hit repeatedly what happens is it breaks up those tau proteins. They leak from the cell membranes. Your body sees that as foreign and begins to attack it. So inflammation happens around those leakages. And under a microscope, they can actually see the phosphorylated tau proteins, so the inflamed tau protein leakage. And it's that phosphorylated tau protein that accelerates the aging process. And unfortunately, under the microscope, they've actually seen CTE evidence in high school players. So it's not something that you have to play for a long time. Frontal temporal lobe dementia, as its name implies, is there's a deterioration of the frontal and the anterior part of the temporal lobes. This was the kind of dementia that we saw most commonly in our football players. And then vascular dementia happens when there's blood vessel disease. So either a stroke, that's what we see on the image on the right, or deep strokes, tiny strokes, multiple tiny strokes, and we'll often see frontal lobe damage with that. Lewy body dementia, there are these certain, they're called synuclein plaques that form in the basal ganglia, but also in the back half of the brain. Lewy body dementia, just some things that are important to remember. So associated with Parkinson's, also depression, often presents with visual hallucinations. So as it damages the occipital lobes in the back part of the brain, people will often sort of classically have visual hallucinations, and don't put these people on antipsychotic medication. Some of the antipsychotic medications can actually put them in a coma and kill them. Alcohol-related dementia, actually something that we see commonly at Amen clinics. Chronic fatigue syndrome. Initially, those patients 20 years ago were thought of as just sort of, quote, psychiatric patients. It's all in your head. Well, it turns out it is in your head, but it's probably viral or several viruses together that cause a progressive deterioration of cognitive function. Mild cognitive impairment, we often see the beginning of hippocampal damage and then frontal or parietal lobe damage, depending on is it frontal temporal lobe dementia or Alzheimer's disease. Brain injury is a common cause of dementia-like process. And you know, people who are older are more likely to fall. So what can you do to prevent Alzheimer's disease, or to at least, because that term really upsets some people, decrease your risk for it? Well, one, you want to know what your risk is, and you want to directly attack the risk factors. You want to keep your body and brain active, antioxidants, beta amyloid reducing agents. You want to modulate glutamate because too much glutamate becomes an excitotoxin, and you want to enhance acetylcholine. Really, the first step is to know and reduce your risk. So, if you have it in your family, that's a risk. You can't change your family. It's associated with a number of genes, like the presenilin gene, and also the apolipoprotein E4 gene. Of course, we inherit a set of genes, one from your mother's side, one from your father's side. People who have one of the ApoE4 gene have 2.5 times the risk of getting Alzheimer's disease. People who have 2 genes have 5 to 10 times the risk. So it doesn't mean you're going to get it. It means you're much more likely. And in my book, Preventing Alzheimer's, that I wrote with neurologist Rod Schenkel, we actually advocate if you let your child play contact sports, the first thing you should do is get a genetic marker. Because if they have the ApoE4 gene, you shouldn't let them play. Now, I'm not a big fan of it anyways, but if they had the E4 gene, because if you have a brain injury and you have the E4 gene, it accelerates your risk even further. We've known that for some time. There's actually a study published in the 90s where boxers who had one of the E4 genes started to show cognitive impairment after their 11th fight. Boxers who did not have any of the E4 genes actually did not show cognitive impairment until after their 30th fight. So not all boxers end up with cognitive impairment. A very high percentage do. I'm in a movie called After the Last Round, what happens to boxers after they retire. But there's some where the damage clearly is accelerated. And there are others that actually take fairly good care of themselves and you don't see evidence of it. So genetic predisposition matters. Brain injuries increase your risk for Alzheimer's disease. So how do you decrease your risk of a brain injury? Well, you wear your seatbelt. You don't let your kids play contact sports. You're not, when you're 80 years old, you're not up on a ladder or up on the roof cleaning out the gutter. I mean, you're really thinking. Brain is soft, skull is hard, skull has many sharp bony ridges. I'm going to do whatever I can to protect it. Alcohol abuse increases your risk of dementia. So what can you do today to decrease your risk of getting Alzheimer's disease from alcohol abuse? No more than 2 glasses a week. If you're overweight, if you have metabolic syndrome, more than double your risk for Alzheimer's disease. So what can you do today? You can start eating like we're talking about in this program. If you have cardiovascular disease, including high blood pressure and lipid problems, you have a higher risk. So what can you do? You can take those seriously. This is where the whole concept of brain envy comes in. A lot of patients, because they have these problems, have brain damage. And then they can't follow through. And what the doctor assumes is they just don't care, when in fact, if they don't fix their brain, they won't be able to fix their body. It's your brain that pushes you away from the table, telling you that you've had enough. Cerebral vascular disease, so any vascular disease increases your risk. So how do you prevent vascular disease? Diet, exercise, and if you have them, you take them seriously and you work closely with your healthcare professional to get them under tight control. If you exercise less than twice a week, you have a higher risk for Alzheimer's disease. So what can you do immediately today to decrease that risk? Exercise more than twice a week. It's not that hard. If you dropped out of school, you have a higher risk. Isn't that interesting? So who drops out of school? Kids who have ADD drop out of school like 8 times more than kids who don't have ADD. So getting that diagnosed and formally treated is important. Diabetes increases your risk. Now, if you have something like type 1 diabetes, clearly not your fault, but having it tightly controlled with diet and medication is just absolutely critical. If you smoke, that increases your risk. You know, smoking is the #1 preventable cause of death. 500,000 people die every year still in the US from smoking. Now, initially, they thought that smokers had a decreased risk, because when they looked at elderly people, they found there were less smokers. And so all the smokers are like really happy, I'm smoking and it decreases my risk for Alzheimer's disease. They were really happy until they figured out how it decreased their risk. Dead people don't get Alzheimer's disease. But then when the researchers corrected for the dead people, what they found is it does increase your risk. Parkinson's disease increases your risk. In fact, people start to get dementia within 3 years of having Parkinson's typically. Untreated depression, so untreated depression in women doubles the risk. In men, it quadruples the risk. Some people actually think depression is a prodrome. So depression in middle age or older age is a prodrome for Alzheimer's disease. Untreated ADD. Why? Because untreated ADD is associated with all sorts of these things. You think of untreated ADD, it's associated with brain injuries because of the impulsive, restless behavior. Untreated ADD is associated with alcohol abuse. It's also been shown to double the risk for obesity. Because people with ADD are always sort of behind and on the run, they don't exercise, there's a higher incidence of less formal education, of smoking, nearly double the risk of smokers in untreated ADD, and a higher risk of depression. If you have low estrogen, especially there was a study of women who had hysterectomies, who were not given hormone replacement, had a higher risk of Alzheimer's disease. If you have low testosterone levels, you have a higher risk of Alzheimer's disease. And you know what lowers testosterone levels? It's sugar. You get a sugar burst, it can drop your testosterone levels in one study by up to 25%. So low libido may not just be a sign that your marriage is in trouble. It may be a sign your brain's in trouble. Sleep apnea, critical. We've talked about that. It's critical to get it treated if you've had cancer treatment. So if you want to prevent Alzheimer's disease, you want to be on a cancer prevention program. And what that means is 5 to 10 servings of fruits and vegetables a day. And I always say you should have 2 to 3 times the vegetables as you do the fruit. High homocysteine levels, a measure of inflammation, has been associated with Alzheimer's disease. And getting your nails or hair done too often. Cosmetologists are actually one of the professions at the highest risk for Alzheimer's disease. And you think of why, and it's because they're around environmental toxins. I remember I broke a nail on a trip and I was in Boston. So I walked into a nail salon to get it fixed, or at least trimmed properly. And I immediately walked out because of the smell. It was just so awful. So the prevention strategies, know and change your risk. So many of these risk factors we talked about, they're moldable, they're changeable. I mean, immediately you can protect your brain, stop drinking, start losing weight, exercise, get engaged in new learning, manage your blood sugar, stop smoking, get depression treated. Now, get depression treated does not mean take an SSRI, because head-to-head, exercise, fish oil, and ant therapy have been shown to be equally effective. So you can certainly at least try it without. As a psychiatrist, that's not working, I'm going to put you on supplements or medication. But I want you to first think, first do no harm. So know and change your risk. Know your ApoE status early, even in childhood if you play contact sports. Now, I usually recommend that my patients just pay for it separate and keep it out of your medical record, because at some point, insurance companies are going to penalize you for knowing your risk. So I would just keep it out of your medical record. Exercise, brain exercise. So new learning. Learning a language, learning a musical instrument, learning a new dance step, learning a new sport. You always want to be learning and doing different things. Brain games can be helpful. But if you play brain games, so Lumosity is big, we have our own site where we have our own games that we really like a lot. But if you're going to do that and eat badly, not take care of your health, it's better than playing Grand Theft Auto. So it's better than playing a violent game, but it may not be as helpful as you think. Curcumin plus vitamin D has been found in lab studies to reduce beta amyloid plaques. And if you're going to take pain medication, so I actually advocate fish oil can help decrease chronic inflammation from pain, but I would rather you take ibuprofen than acetaminophen, because people who take ibuprofen, it's been found they have Alzheimer's disease later, where people who take acetaminophen found on average in population studies they get Alzheimer's disease a little earlier. Mostly because acetaminophen disrupts glutathione production in the liver. So have the kind of diet we talked about. It's an Alzheimer's prevention diet, restricted, not too many calories, high in antioxidants, omega-3 fatty acids, B6, B12, and folic acid have been shown to decrease the progression of MCI to Alzheimer's disease. And then you want to have tight blood sugar regulation, chromium, alpha-lipoic acid can be helpful for that. Early detection, according to one study from UCLA, Jeff Cummings' group, that 95% of people with Alzheimer's disease are not diagnosed until they're in the moderate to late stages of the disorder. And when does treatment work? Does it work early or late? I mean, if you were going to bet, looking at the scan images, that by the time someone has dramatic dropout of their parietal and temporal lobes, it's going to be a lot harder to treat them than if you can get them early. They've also shown that smell identification tests have helped to identify it early. So if you're having trouble smelling strawberry, pineapple, lemon, or natural gas, that's an early sign. Now I'm thinking, if you're having trouble smelling natural gas, you may not live to Alzheimer's disease because you'll be dead from the gas leak. Early treatment strategies. You want to work up other causes of memory loss, and there are a whole bunch of them, from hypothyroidism to something called normal pressure hydrocephalus, to having Lyme disease. And the prevention strategies that I like, diet, exercise, brain and memory power boost, what we really like about it has ginkgo, vinpocetine, huperzine A, and acetyl L-carnitine. Early on, the acetylcholinesterase inhibitors like Aricept can be helpful. There are a dozen spec studies with Aricept shows that it increases blood flow, especially to the front part of the brain. Memantine is a glutamate modulator. So if glutamate is low, it tends to raise it. If glutamate is high, which is common in dementia, it tends to calm it down. Here's a patient that had viral encephalitis when he first came to see us, shortly after Namenda came on the market. So we put him on Namenda to see what would happen. And you see he's got better temporal and frontal lobe function. And it calmed down his cingulate gyrus. He's very repetitive in his thinking. So Namenda was actually a nice balancing agent. I actually used Namenda in some kids with learning disabilities and have found it to be helpful. I'm so excited about the idea of managing brain aging. Now I'm getting more excited about it as I turn 60. But I have seen truly terrible brains with age. I mean, we really see it with the scans. This is what the brains do. They just get less and less and less and less active. But it doesn't have to. If you engage in the right strategies, you can dramatically decrease your risk. And there is no time in your life where having a bad memory is normal. You know, it's like, well, I'm 40, my memory's no good, that's normal. It's like, no, you have bad habits. Or Marianne, the story I told you about earlier, 59, it's like, my memories go good. Oh, well, that's normal. It's like, no, you have bad habits. And as she fixed her health, her memory was better. She has a fast-acting brain with the wisdom of age. Even 70, 80, 90. Now, typical maybe. Clearly not in your best interest.